Good evening, everyone. I'd like to welcome members and officers to this Overview and Scrutiny Committee meeting and also welcome anyone watching online via the North Herts YouTube channel. Before the meeting starts, I'd like to invite the committee clerk, Robert Philby, to explain how proceedings will work and to undertake a roll call of those attending remotely.
Good evening. Can I confirm that the following officers are in attendance and can hear us and we can hear them? Joe Dufficy.
Yes, good evening.
Thank you. Chris Jeffrey.
Good evening, President.
Thank you. And Polly Simmons.
Yes, good evening.
Thank you very much. Rules of debate. If a member wishes to speak, they should use the speak button located on the microphone unit. The microphone will light up green and the chair will be alerted of your request to speak. When the chair invites you to speak, your microphone will be made live and will turn red, at which point you can speak. The normal procedure rules in respect of debate and times to speak will apply. When requested to vote, voting will take place via the yes, no, abstain buttons on your microphone unit. Details of how members voted will be shown on the screens around the room and the result will be visible on the YouTube stream. In the event of a tie to vote, the chair will have the casting vote. Are there any questions before we start the meeting? I will hand back to the chair.
Thank you. Okay. Item 1, then, apologies for absence. I've received apologies from Councillor Tina Bartois and Councillor Elizabeth Dennis. Having given due notice, Councillor Emma Fernandez will be substituting for Councillor Bartois, and there are no further apologies because everybody else is here. Item 2, the minutes 7th of January 2025. I'd like to propose that we take as read and approve as a true record the minutes of the meeting of the Overview and Scrutiny Committee held on the 7th of January 2025. Could I have a seconder, please? Councillor Munzer, thank you.
Happy to second, Chair.
Okay, thank you. Are there any comments on the minutes? Okay, in that case, we'll go to the vote, please.
That's carried, Chair.
Okay, moving on. Item 3, notification of other business. No other business has been notified. Item 4, Chair's announcements. Number 1, in accordance with Council policy, this meeting is being recorded. The recording will be available both on the Council's YouTube channel as well as on the Council's ModGov site alongside the documents from this meeting. Item 2, members are reminded to make declarations of interest before an item. The detailed reminder about this and speaking rights is set out under Chair's announcements on the agenda. For purposes of clarification, 4.8.23a of the Constitution does not apply to this meeting. Therefore, a member may leave the room during the debate and consideration of that item and be able to vote. However, please be mindful of the business on the agenda and wherever possible, leave at an appropriate point in the proceedings. Members are reminded that we have adopted a scrutiny charter which outlines how we conduct scrutiny at North Herts Council, including the need for independence, initiative and integrity. It is important that all members are mindful of this and how they approach the items on the agenda tonight and at future meetings. Full details on the adopted charter can be found on the Council's intranet page for members. Finally, I plan on taking the updates and questions on agenda item 11, the work programme, and agenda item 12, decisions and monitoring tracker, together this evening. However, they will require separate votes to approve, and for future meetings, those will be merged into one report. Okay, item 5, public participation. There is no public participation. Item 6, urgent and general exception items. There are no urgent or general exception items. Item 7, called in items. No items have been called in. Item 8, members' questions. No questions from members have been received. And item 9, health matters. Michelle Campbell, Rachel Hawksworth and Steve Claydon from the Herts and West Essex Integrated Care Board have come to join us this evening. Actually, it's just Michelle and Steve, isn't it? Yeah. Sorry about that. They're going to present to us on dentistry provision in North Herts. So thank you. Over to you.
Thank you. Thanks for inviting us. As the Chair said, my name is Michelle Campbell. I'm Head of Primary Care Contracting at Herts and West Essex ICB with a portfolio for both general practice and for dental contracts. And I'm here with my colleague.
And good evening, councillors, ladies and gentlemen. My name is Steve Claydon. I am a dental surgeon by profession, also a specialist in orthodontics. It is really nice to be here this evening because I'm very much on my home turf. I live in Royston and have done for 11 years. Prior to that, lived within 2.5 miles of the county border for about 20 years. I practiced from 1988 to 2023 at various times in Baldock and Ashwell. So I know the area extremely well, and it's so nice to be, as I said, on my home turf and not flying across some different counties. So good evening to you all.
Okay, so we have prepared some slides, which I believe will be shared with you all after the meeting. Some of the slides are very detailed, so I do apologise for that, but hopefully my summary will give you all the information that you need. So next slide, please. So just a bit of a history, really. So the ICB took over delegated commissioning of pharmacy, community pharmacy, optometry and dental services from NHS England in April 2023. So we're coming up to 2 years, but we are still learning as we go along and getting to understand the landscape of those contracting groups. So I think the first thing to say about dental practices, unlike GP practices, they don't operate a registered patient list. So patients can access dental care from any dental practice that they choose. So that means not only are we serving the population of Hertfordshire and West Essex as per the ICB footprint, but also patients that reside outside of the ICB boundary can also receive care from one of our dental practices and vice versa. So it's just really I think it's quite useful to have that in the back of our minds when we're talking about access and what the ICB's powers are in how we improve that position going forward. So a bit about the National Dental Contract. So it's called a General Dental Services Contract. There's 2 types, General Dental Services, and that's to provide mandatory dental services as we know it from a high street dental practice. Contracts are commissioned based on a level of units of dental activity, and that varies from contract to contract based on a baseline reference year prior to 2004 when the National Dental Contract was implemented. Within each contract under the NHS, there are 4 treatment bands. So you have your band 1, which is basically your assessment, your examination, any radiographs that you might need to have. Band 2 is more things like fillings, and band 2 is then split into further 3 elements. I think that's the case for a band 2.
Yeah.
And then band 3, which is your more complex treatment, which by rule of thumb would incorporate an element of laboratory work, so dentures, bridges, etc., etc. And then there's also an urgent course of treatment, which is your 4th course of treatment. The national contract allows for a 4% under delivery each year on that individual contract base, or a 2% over performance. So if there is a 4% underperformance, then they are allowed to take that activity forward into the next contractual year. And if they overperform by 2%, that activity is then deducted from the baseline the following year. So what we try and encourage is that they don't overperform so that we can start from a level playing field from the 1st of April. But we also have the ability as the Commissioner, and if funding allows, to pay for that overperformance. So we're always trying to start from that level playing field at the beginning of the next contract year. We have personal dental services contracts, which I mentioned, which are more for locally commissioned services. So things like orthodontic services are commissioned under a personal dental service contract. Not very much different in terms of the regulations, except that a PDS contract, as we call them, are time limited. So they can't be in perpetuity, whereas the general dental services contracts are in perpetuity. We can also commission other more locally defined services from a PDS contract, such as oral surgery, sedation, some of our level 2 services, which I will touch on as we go through the presentation. So what are the delegated functions? The delegated functions in relation to dental contracts allows the Commissioner, the ICB, to make decisions around relocations of contracts, changes to the activity base and the value of the contract, add partnership changes or changes of the contracting body, if you like. We are able to do incorporation requests and just the standard contractual performance and assurances on the delivery of those contracts. Next slide, please. Oh. Okay, so for Hertfordshire and West Essex, we inherited 231 contracts. As you can see, we're now down to 229. So we have had 2 of our GDS contracts handed back since we took over delegated commissioning. That 229 contracts is made up of 185 high street dental practices, 21 orthodontic contracts. We have 2 special care dental services. And when I say special care dental services, you might have heard the term community dental services. So there are one of sort of similar services. We have one provider for Hertfordshire, and we have one provider that covers the West Essex part of the patch. We also have there is a prison dental service, but that is not currently managed by the ICB. That's been retained by NHS England and the specialised commissioning team. We have a domiciliary dental service that goes out and sees residents in their homes, predominantly in care homes, but it does cover all residents that are classified as housebound. And then we have some ancillary contracts, like I mentioned previously. So we have 16 intermediate oral surgery contracts. So these are oral surgery treatment that's provided that doesn't necessarily need to go into hospital. So we're trying to make sure that the patients can receive care in the most appropriate place. And we have specialist providers delivering that care. And in addition to that, we have 2 sedation only contracts. I say sedation only because some of the minor oral surgery contracts also provide element of sedation as part of that course of treatment. We are also responsible for secondary dental commissioning as well. So we have 3 acute trusts across the ICB. I think it's safe to say, isn't it, Steve, we're still getting a handle on the activity that's provided within the acutes. I think data is quite a challenge, and we're working with our providers to try and sort of mitigate that so we can get a better understanding of what's available in the acutes, what's delivered, and where the gaps are and waiting times, and what can we do to try and work with our acute providers in trying reducing the waiting times. Thank you. Next slide, please. I don't think any of these will be a surprise. We've just listed some of the challenges that both providers and commissioners face with regards NHS dentistry. So obviously following COVID, there has been an increase in patient demand and an increase also with patients presenting with more complex treatment needs because of that not being able to receive care during the COVID year. We have nationally and as locally as well, but a workforce retention and recruitment challenges. I think Herts and West Essex, when we look at our workforce data, we are one of the best ICBs in the east of England that has good workforce recruitment and retention rates, and that is increasing. So that's really, really good that we're starting to see some real successes in terms of our recruitment processes. The contract itself, it's largely unchanged since 2006. The shift from the previous items of service contract to this contract, where there are funded, restricted funding for the treatments that they're provided, in itself provides some challenges to our providers in the financial sustainability and resilience of practices. And that's largely due to the way that the contract is remunerated, the increased cost due to, inflation, the higher lab fees, and the cost of living rise in its, as we're all feeling it, I think. And then obviously the contract is very focused on activity delivered rather than improving outcomes. And that's what we need to see, is how do we improve the health, the oral health of our population. Next slide, please. So this slide, again, sorry, it's very text heavy, but this just gives you a feel of where the ICB is heading strategically in regards to dentistry. So we have developed a primary care strategic dental delivery plan that we developed in 2023, and there is a link, I think it's on our website, so happy to provide all of these links to these relevant documents that I've mentioned. Within there is a dental element, and that's around urgent access to dental care, how we can enhance the oral support to the population, working in collaboratively with our public health teams in the local authority, which we do very well in Hertfordshire. How can we improve the reach out to care homes? So I'll tell you a little bit later on about a pilot that's happening in Hertfordshire around supporting care home residents and identifying their treatment needs. What can we do to support our workforce? So we know, as well as the same as general practice, you no longer need to go and see a dentist for your treatment. There's a whole plethora of dental care professionals that have the necessary skills to provide certain levels of treatment. So how can we utilise the skill mix of the workforce better, rather than just having to go and see a dentist? How do we use our dental nurse therapists and hygienists? And then it's looking at what impact has there been around the planned care that we're delivering, and that will hopefully over time reduce the need for urgent access. So that's sort of the core things that are in our strategic delivery plan over the next up until 2026 now. We've listed then down the ICB priorities that were for 24-25, and they are largely aligned for 25-26. And you can see in all but one, some of the priorities in the work programmes we're aiming to deliver for NHS dental services supports all of those ICB priorities, apart from the bottom one. And we need to look at how we can work better and support our vulnerable communities. Next slide, please. And then the national picture. So we all recognise that access to NHS dental services is a challenge, and it has been a challenge, and it will remain a challenge until we can make some inroads into some of our commissioning schemes. So on the 7th of February last year, there was a joint plan published by the Department of Health and Social Care and the NHS on how they intend to recover access to NHS dental services. It outlines changes that support sort of two main areas, and that's around prevention. So how can we impact or have an impact on the prevention agenda to improve that oral health position? And as I said, we are working in partnership with our local public health local authority teams through the Oral Health Alliance group that we reignited in September last year, looking at what we can do with local authority and health working together rather than in isolation to get the outcomes that we need for the population. And then the second part of that plan is around how do we increase and improve access and delivery of the dental contracts that we've commissioned. And ways that the plan supports that is that they have introduced an incentive tariff for practices to see new patients. And when I say a new patient, it's a patient that has not received dental care the previous 2 years from that dental practice, from that dental contractor. That part of the plan actually started on the 1st of March 2024, and it runs right through to the end of March this year. And actually, I think we're quite astounded at the impact that has had. As you can see from the slide, to date, there have been nearly 90,000 new patients accessing dental care since this is only from the 1st of April. So there would have been more if we take the March data as well. What that has meant, though, it has had a bit of a perverse consequence in that it is utilising all of the units of dental activity that we're commissioning at a much faster rate than we've seen delivered in the previous year. So as much as it's intended to give access to new patients, it has a unintended consequence of reducing access to patients that would be seen regularly, because the activity is just not there, and it's now reliant on commissioners to look to see if they can fund that additional activity with some very limited financial resources that we're all experiencing. There was a national increase to the UDA rate. So the way the UDA rate is calculated was based on that reference year that I mentioned previously. That would determine what the contract value would be for an individual contract and what level of units of dental activity would need to be delivered. And if you take the contract value and the number of UDAs and divide it, you'll get the UDA rate. In 2022, when the dental contract reform, I think, was originally introduced, there was a push to increase the national UDA rate up to £23. So, you know, the UDA rates vary. And I think for Hearts and West Essex ICB, it did range from £26 right up to, in some cases, £43. So there's a vast difference. Under this plan, it then pushed the national UDA rate up from 23 up to 28. And actually, because we've got some quite good UDA values and the way the services are commissioned across the ICB, there was very limited number of contracts that were below that 28 mark. So now everybody has been brought up to that minimum baseline. In order to support some of the workforce recruitment and retention, the plan also introduced what they called a golden hello. So that was really an incentive to recruit new dentists to the area and retain them in the local area for a period of time. It was for a 3-year period. The incentive payment was £20,000 for a newly recruited dentist into a practice, and they received a phased payment for year 1, year 2, year 3 to try and retain them in the local area. So across the east of England, that meant that there were an allocation of around 41 whole-time equivalent new dental roles that they would support payment for. And for Hearts and West Essex, our allocation was 3 whole-time equivalent. That was based on the current access rates across the ICB, as well as the current workforce rates. And as I said, we've got one of the best workforce rates across the east of England. We also have one of the best access rates as well. So that's why our allocation was quite small compared to some of our neighbouring ICBs. We did put an expression of interest out to all of our dental contractors to say, here's the offer, let us know if you're interested. We did have, I think we had about 10 expressions of interest, and we went through the eligibility criteria, and we were only able to offer out 1 whole-time equivalent because that contract met the eligibility criteria in the plan. We've since reached out again, and we haven't had any applications to support this, but the offer is there, and that will continue into the plan, and we will work with our providers should they wish to take up that scheme. And then the last one, which isn't actually relevant for Hearts and West Essex because of although we have issues, I like to say we are quite fortunate in our position for NHS dental services, but it was the introduction of mobile dental vans. But that was specifically for the rural coastal areas that have real low access and low commissioned activity. So people Norfolk and Waveney and areas like that. So actually Hearts and West Essex aren't eligible for that part of the plan. We are expecting further contract reform measures, and I know I met with the national and regional team a couple of weeks ago to look at what the next steps might be. Obviously, that needs to go through legislation and the Secretary of State to make changes to those regulations, but hopefully we should start to see some of the changes coming in over the next 6 to 12 months, which will help support some of the challenges that I mentioned earlier. Next slide, please. So access in Hertfordshire. So what have we done since we've taken over delegated commissioning? Well, we have introduced a enhanced dental access pilot. And the aim of that pilot was to offer urgent access appointments 7 days a week, both in hours and out of hours, including bank holidays. Where a patient was unable to access an NHS dental practice and was clinically triaged as requiring an urgent appointment within the next 24 hours. Originally, that pilot was commissioned just for 6 months, but it was so successful, and we knew there was a demand for it, but I think we were a bit naive on the level of demand that was needed. So we've actually extended that pilot right through to the end of March this year. So it's been running for more than a year, and to date, I mean, the data here is just under 7,500 additional appointments, but that was using the December data. So I think by the end of March, I think we're near on going to be able to report that we would have delivered 9,000 to 10,000 additional urgent appointments for patients that wouldn't have routinely been able to access an appointment. We did have 4 locations in hours providing those urgent access sessions. Unfortunately, the provider in Hitchin, which would serve the North Herts jurisdiction, pulled out at the end of the original 6-month pilot. We don't know why, didn't give any reason, but they just withdrew and said they didn't want to continue, and we were unable to replace that activity. What it does mean, though, is we've got huge data sets to support the continuation of some sort of urgent access scheme. And we're just working through our business planning process to identify what that might look like for next year. So the pilot won't be pulled. There will be some sort of service in place. And we're just working through how we can improve on the model that we've already got so that we can continue that. And then we also have our dental out of hours service, which we are quite fortunate in Hertfordshire. I think, we do have a dental out of hours service that provides dental appointments, weekday evenings, weekends and bank holidays. And not many ICBs do have that service in place at the moment. So I think we're quite fortunate. But we did double their capacity so that they were also able to participate in this pilot and offer additional appointments out of hours, specifically at weekends as well. Next slide, please. So this slide just gives you a bit of a breakdown, really. It's a lot of data around the types of treatment that is provided across all of the contracts for 21-22 up to 23-24. We will obviously refresh this data once we get the 24-25 data from the the NHS Business Services Authority. But really wanted to just give you a feel of, I think it's quite telling the level of urgent treatment that's provided, because that would indicate that, these are patients that don't routinely see an NHS dentist. Not all of them, obviously, but a large proportion. So for children specifically, out of all of the treatment that was provided over those 3 contract years, on average, just over 3% of treatment was provided to children. And for adults, it was double, just over 6% for urgent courses of treatment. And then hopefully, as we improve the oral health of the population, we'll see a bit of a shift from the urgent courses of treatment into the more routine planned care, and hopefully also the reduction in the more complex treatment band 3, because we are managing to maintain our population's oral health. Next slide, please. This is the same data, but just split down by graphs, really. So just to give you a bit of a picture view. Next slide, please. So this is what it means for North Herts. So again, it's the same data, but I've broken it down for each of the localities. And this is the North Herts data in terms of the sum of all of the urgent treatments provided, the band 1s, the band 2s, the band 3s. and split by adult and child. Now, as I say, we do get quite a richness in data from the Business Services Authority. So if the committee is interested in a deep dive, then I'm more than happy to do that and circulate that to you in terms of the types of treatment that's provided. Next slide, please. Next slide is around the prevention and the equality. So we have got a dental access and dental health review that was refreshed by the East of England Consultant in Dental Public Health, late 23, early 24. That's given us some really good data on the oral health of the population and where our hotspots are. And when I say hotspots, it's the areas with low access but high need. And for this area, North Hertfordshire has pockets of population density, deprivation, and the next couple of slides down, I'll be able to demonstrate the map of where our contracts are and how they align with those pockets of population density. But we focus, every time we commission something, we do need to target and prioritise where we place those services. And it is based on that dental access and dental health review. So we try and target and put services in places that we've listed here. So Broxbourne, Dacorum, North Hertfordshire, Epping Forest, Harlow and Watford, because they are our areas of, highest deprivation, highest population density and low dental access. Next slide, please. So this slide is just a bit about oral health and health inequalities on some of the work that's happening with both under the local authority and with us as an ICB. And like I say, we're working collaboratively with them in terms of what are we doing to improve the oral health of the population. So some of the things that are going on within the local authority is about providing pop-up dental clinics, reaching out to family centres to do some oral health advice, reaching out into schools to apply fluoride varnish and training and education and everything. And then also participating in the National Dental Epidemiology Programme. So that is an annual programme where a cohort of patients are surveyed and assessed to determine and provide us with some really rich data on the oral health. So last year it focused on year 6 children, and this year it's on care homes. So I think, some of that data really helps us as commissioners in prioritising some of our work programmes. We also, since delegation, have invested quite significantly into the Hertfordshire Community Dental Service because when we took over the delegated commissioning and we did a review and analysis of all of our contracts, the service provided in Essex was at a much higher level than the service commissioned in Hertfordshire. So there were some commissioning gaps in the Hertfordshire service. So since we've taken over the delegated functions, we have invested quite significantly into the Hertfordshire service to introduce bariatric chairs so that there is access to NHS dentistry for bariatric patients, which previously would have been referred up into Bedfordshire. We have invested in funding to implement an anxious patient pathway. So that is providing techniques to patients with dental phobias and dental anxiety that would have routinely been referred into the London acutes, who are now rejecting out of area referrals. So we had nowhere to send these patients. So now our Hertfordshire Community Dental Service sees those patients and it's working really, really well. Okay, next slide, please. So this is the map of the ICB and our areas of deprivation and population density on the left, and on the right, or the blue blobs, which you probably can't see very well, but that is where all of our NHS dental contracts are placed. So pretty much mirroring where our population and needs are, with just probably a little bit of flex. As I say, we'll share these slides out with you after the meeting. If you can go to the next slide, this then drills down into North Hertfordshire. So again, the left-hand slide is the North Hertfordshire map. The dotted areas are the areas where there is population density, a couple of red spots, which you probably can't see as well, but that's where it's the 20% most deprived areas. And then if you look over to the right, and again, I apologise for the small map, I was trying to get into one picture. The green circles are where our NHS dental contracts are located. The number in the circle indicates the number of dental practices that are in that local area. So for North Hertfordshire, you have 20 dental contracts across your boundary. 18 of those are GDS, so your high street dentists, and 2 of them are orthodontic practices. And one of the GDS practices, the one in Ashwell, also provides oral surgery. So for your boundary, you are quite well served for NHS dentistry. I think there are around 240,000 UDAs commissioned across those 18 contracts. And just to put it in some context, that represents nearly 14% of all contracted activity in Hertfordshire based in North Hertfordshire, and just under 11.5% of all commissioned activity across the ICB based in North Hertfordshire. Next slide, please. This is just to give you a bit of a view around the dental workforce and where each of the place teams across the ICB sit, so West Essex, South West Herts, and East and North Herts, and how that compares to the East of England region and national. So I think, you know, we're quite well above average compared to the both of those, and hopefully we'll continue to see that improving as we go on. Next slide, please. I think we're near the end. This is around some of the work that Healthwatch have done. So Healthwatch have got a plethora of reports on oral health and dental access going back from, I think, 2016. And what we have done as an ICB is we've commissioned Healthwatch to deliver 4 programmes a year on topics that we have chosen. And they will go out and do a bit of a deep dive, do some surveys. And we are just about to embark on one for oral health, so specifically children's oral health, so we can really understand, you know, why are children accessing services, you know, via their parents. If they're not, what barriers, what are the challenges, what can we do to make a dental practice more inviting for a child to relieve some of those anxieties. So we have just signed off the survey this week. That will be, I think that will go live on Thursday, and that will run right through until the end of March. And then we'll hopefully have the findings and recommendations during April to help inform some of our work programme for next year. Next slide, please. So this is the last slide, and I've just outlined some of the dental priorities that we've currently been working on or plan to work on over the next year or two. And I've split it out into the area. So obviously urgent on the day access. We need to continue commissioning that and reviewing what we've got in place and how can we improve on that position. We need to review our out of hours dental contract that comes to an end, and we naturally have to review and re-procure that. So we need to start doing that piece of work. Working again collaboratively with our public health teams in the local authority. What can we do together to improve? What initiatives can we implement to improve the oral health of the population? The care home pilot, as I mentioned, you know, our community dental service has been reaching out to care homes and assessing residents in the care home to really understand what their treatment needs are, because actually what we are finding that a lot of the residents in the care homes are not consenting to treatment because the carers aren't, or their family aren't consenting to it, because then they have to pay for it. So some of our, you know, they're not exempt from paying for NHS dental services. And but what is it actually? What is their treatment need? And what we found is actually there's very little treatment need that's required for this cohort of patients. It's more about education. How do you look after your denture? How, training on how to properly clean your teeth, and actually educating the care home staff as well to make sure that, that they are looking after their dentures well in the way that they should be, etc. We're expanding that across a number of other homes. And then during 25-26, we hope to build on that pilot. How can we integrate our high street dentists in supporting some of the care home residents where there is a treatment need? So hopefully we'll be able to build on that in the next 12 months. We're also looking at how can we work with our current dental contractors to maximise delivery of their contracts. So I mentioned right at the very beginning that there is a 4% tolerance of under delivery, but we have a large number of contracts that deliver less than 96%, and we are then required to claw back that activity up to 100%. So every year there is lost activity, if you like, that we've lost through that year. So what we want to do is try and work with them to maximise the delivery of their contract. So every commissioned activity is delivered through dental care to patients. What we can do from April 2025, which is really good news for us as commissioners, is we can unilaterally rebase a contract if there has been persistent underperformance the previous 3 years, so that we can take the average of those 3 years and we can rebase the contract to that activity level. And what that means is the activity that then comes back to the ICB, we can redistribute to the areas where we need it, to those contracts that are asking for more activity because of the demand that they're seeing. So we've already started that piece of work. And I think that's quite fundamental to make sure that out of the 2 million UDAs that we commission, we're delivering year on year 2 million UDAs rather than 96% of them. And I think that draws me to a close. So thank you all for listening. I know it was quite heavy going, but I'll open the floor to questions.
Thank you very much for that. There are some questions coming in, so we'll go straight to Councillor Muncer, please.
First one on. Thank you very much for that. That was a really interesting and detailed presentation. So when I'm out and about knocking on doors, speaking to people doing Codicott and Kimpton, they tell me their struggles as to not being able to access an NHS dentist. And since 2011, the population of North Hertfordshire has increased by around 5%. We've got a local plan which is going to, deliver nearly 13,000 homes across North Hertfordshire. And I note that, the UDA at this present moment in the district is 240,000. With new development that is proposed, what strategies has the ICB in place in order to ensure that actually, dental service provision in the district keeps up with that growth?
That's a very good question, because we are having the same conversations, I think, across all of the district and borough councils, because they've all got a local plan and they've all got housing growth. So as a health, how are we, looking to support that? And I think we don't have an answer at the moment. I think what we need to do is understand what is the growth across the whole of the ICB, and we're working with our ICB premises team to understand that housing growth and over what period. I think any commissioning that we need to do for dental services has to be targeted in the areas that it's needed. So we do have to focus firstly on those areas with low access and very high dental needs. So that, as I said, there's pockets in North Hertfordshire that would come into that. That would be our first priority. But then obviously within our very limited financial resources, it's how do we support the expansion of our communities. So we'd need to work very closely with our district and borough councils to really truly understand what that looks like and how we might be able to support it.
Could I just follow up on that? Because I completely hear and understand the challenges with respect to commissioning. Could I just ask, though, what consultation takes place with the ICB with respect to when a development of substantial size that warrants a Section 106 agreement, for example, to come into force? is it the norm for the ICB to then request contributions from the developer either to support, GP service additionality or, increased dental provision?
It does. We've got our premises team works very closely with the planning teams in the local authorities. And so when we are advised that there is this potential planning application, then our premises team will draft the response, and it will incorporate all primary care services, not just general practice, which it has historically been.
Just to follow up on that, how does that work in Royston? Because a lot of the planning applications I've seen come from the Cambridge and the health input is from the Cambridge and Peterborough ICB, whereas obviously the dentistry is covered by Herts and West Essex.
It's interesting you say that, and I thought that might come up before now. So, for reasons unknown to us, when the powers to be decided that they were going to separate out NHS services, they decided that they would put general practice and community pharmacy in with Cambridge and Peterborough, but they would retain NHS dentistry within Hertfordshire. Don't know why. I absolutely don't know why. So I think when it comes to Royston, there would have to be a dual response from both ICB areas in terms of how we intend to sort of meet that demand. So from a Herts and West Essex perspective, it would be for dental, and Cambridge and Peterborough, it would be for general practice and the other services.
Thank you. If I can just
please.
chip in on a personal level, that particular conundrum around Royston is not lost, largely because the dental clinical lead lives there. So I think colleagues are sometimes fed up with the word Royston so often being mentioned. But yeah, we are aware of that anomaly, and I'm not quite sure the history behind it. I think it more relates to how the medical practices were commissioned, because of course Royston geographically is in North Hertfordshire.
Okay, thank you. That's very reassuring to hear. Councillor Winchester.
Thank you. Thank you so much for that very comprehensive discussion. Lots of data in there, and it's lovely to see that you are data driven. And it was also really nice to see to hear your note about the workforce challenge being less acute, perhaps in North Herts and other parts. But do you have any data on kind of the percentage of unfilled roles at the moment, and is that something which is contributing to, for example, dental practices not completing the percentage of UDAs that you're looking for?
So dental providers are required to submit workforce returns to the Business Services Authority. And unfortunately, that data is then not shared with the ICB. So we have been on and on and on, and we keep getting told it will be published imminently. But that has been coming up to 12 months now. And actually, we need that data to understand where our gaps are and where we need to support our practices. And especially if we are going to do a workforce recruitment and retention and development plan, because if we want to develop our dental nurses, our dental therapists, we need to understand what workforce do we have out there already to do that. So there is data, it's being reported, but at the moment it's not been published or shared with ICBs.
Thank you. Councillor Claydon.
Thanks, Chair. And thank you very much for a very interesting and detailed presentation. There was a lot in there, so please forgive me if I ask you a question that was in there somewhere. I'm just wondering, with regards to the sort of balance between, you were talking about under delivery, so some practices effectively are not doing as much work as they should be doing, but at the same time there's an increased demand. So how does that work? How do you end up with that situation? And what are there any consequences for the dental practices that are in that position besides presumably losing some money as a result of it?
I think we might do this on a dual response. So if I take the contractual element, so yes, if they under deliver, let's say they only deliver 90% of their contract. Once we get the year-end data, we then claw back that 10% of that's been under delivered, but it's lost because it's non-recurrent funding. We can use that to do non-recurrent commissioning, but we need recurrent commissioning, but also we need them to deliver 100% of their contract. So that is the impact on the provider, in that yes, they'll have to pay back that over the money that we've paid for the 100% of the contract. Why are they in that position? Well, I think there's quite a lot of reasons. In it's the way the contract is structured. You might hear some dentists saying, "Oh, it's not worth my while doing, you know, a complex. I don't get paid enough for it," and so I don't really want to say it, but, you know, there may be an element of picking and choosing the types of treatment they provide, you know, lots of band one, lots of urgent, not more of the complex, but they might have a staffing issue. They might, you know, they might be one of the practices that haven't been able to recruit, and so that there is a reduction in the clinical workforce to be able to deliver that. They might have what we call a force majeure. So, you know, there could be a local issue that stopped them delivering the contract within the practice. So is there anything you want to add to that, Steve?
I think, Michelle, you've largely covered it, but as part of the ICB's overall contract monitoring, we do keep an eye on delivery. There is a whole process which I will not bore this local authority with around mid-year reviews, and certainly any practice that is under 30% of its annual contracted delivery by mid-year is required to submit a detailed plan as to how they're going to get up to at least 96% delivery by year end. We will engage with them either formally, informally. I think every contractor in Hertfordshire knows me. I've been in role now for 15 years. And certainly North Hertfordshire, they do. So through the ICB, they'll contact me, and if I can offer any practical help or advice, I do, because what we all want is for the commissioned activity to be delivered. As Michelle said, it's done on a year-to-year basis. So if we get to year end and there's X million pounds that's not been delivered, we have to claw it back. We've lost that service in that prior year to be delivered to patients. So we're all pulling in the same direction. We don't want under delivery and claw back any more than my colleagues want to pay on occasions quite big sums of money back to the ICB.
But let's put a positive spin on it.
Yeah, sorry, big
so
negative, didn't it?
Since COVID, we have seen a significant improvement in our delivery across Herts and West Essex. So I think for 22, 23, the delivery was something like 72.5% overall of commissioned UDAs. In 23, 24, that shot up to 92%. So that's, you know, 90%. And this year we are all forecasted to deliver 96%. So, you know, we are getting to where we need to be, which then causes us a problem because we've still got demand. So actually we need to commission more, and where does that funding come from? And you know, so there's a bigger, it's an ongoing piece of work.
You talk about UDAs as kind of the unit that you count. Do you have any idea of how many people you're reaching from that 240,000? How many unique people is that?
I don't have the data. That is something that we would need to request as an ad hoc report from the Business Services Authority. We can absolutely get numbers of unique patients. Yeah.
All right. Thanks. Councillor Winchester.
Thank you. Just going back to that point about not having enough capacity, I was quite shocked. You talked about the scheme where you were able to get 3 whole-time equivalents for the whole ICB for North Herts, but only one of those was taken up. I mean, what was stopping practices having a free funded staff place? I mean,
there were quite a number of criteria. Right. This was set by the national team, and I, again, won't trouble the council with that criteria. But in the end, there was only one dental practice that achieved all of those criteria. To a certain extent, I'm not that surprised, because as Michelle mentioned earlier, within Hertfordshire as a whole, well, Hertfordshire and West Essex as a whole, we are actually quite well served. When you compare to some other parts of England, you go down to the southwest, for example, dentists are about as common as living, breathing dodos down there. You know, they're extremely rare. So we're actually quite well served, which is perhaps one of the reasons why very few practices managed to tick all the boxes to qualify for it.
I think it could also be because a lot of our newly trained dentists come in to then go private because that's where the money is, or they move into London because we're on that border. So some of the comments that I have heard is actually, well, I don't want to commit myself to 3 years in the same local area. because they want to build up their skill and their knowledge base, and then they want to move. But actually, that's the whole purpose of, introducing this scheme, is to retain our workforce in the NHS.
Thank you. You mentioned 2 contracts have been handed back. Was that privatisation, or what were the reasons for that?
Yeah, they went private. I think the first one was that they just couldn't, the contract wasn't remunerating enough, and that they chose to go private, as well as the second one as well. They were really struggling, and we worked with them to say, okay, well, let's reduce your contract if it makes it a little bit easier for you to hit the target. But unfortunately, they took the decision that it just wasn't working for them anymore. So we have been able to redistribute that activity already, try to, in the first instance, try and replace it in the area that it's lost, because it was in a town, it was in Stevenage. And then if that wasn't possible, we would then prioritise where we redistribute to those areas that I'd listed in the slide.
Okay, thank you. Councillor Manser.
Thank you. Could I just focus on the enhanced dental access pilot, because from the figures that you've provided, an additional 7,500 appointments, that's obviously something which is to be strongly welcomed. But what was quite concerning was obviously that the practice in Hitchin withdrew. So just 2 questions, if I may. The first is, I note that you said that you didn't receive a response from the practice as to their reasons. Could I ask, was there any follow-up with respect to that? And the second question is this pilot something that is going to be brought forward into a permanent scheme? And if so, what are you going to be doing to ensure that actually, there is provision for it within North Herts to replace that of which was obviously, the practice withdrew in Hitchin?
So for the first point, this particular practice did challenge the ICB at the very beginning on the model that we had commissioned. So the provider was also aware of pilots that were running in other ICB areas, and our model, as much as it was aligned to that, it was slightly different. I probably will get quite technical, so shout me if you don't understand. So the way our model works is that we pay for sessions. So we don't pay on UDAs delivered. We pay on a sessional basis, which is much more attractive for a dentist to deliver under a sessional hourly rate rather than the UDA-based contract. So we commission 1 urgent access session from each provider every day, Monday to Friday, and they're remunerated to that hourly rate that we've agreed. We've allowed them half-an-hour appointments because obviously they don't know who's walking through the door, so they need that time to gather all of the information, do that assessment. So out of the 4-hour session, they see 7 patients, and there's an element of admin time, or they can see more patients if they want to, or they can flex it. And I'll really get technical and clinical here, and Steve might have to save me, but to provide urgent treatment, you have to have a minimum baseline level of skill. And if you talk to the deanery, there are certain, I don't know the word, it would be inappropriate to use certain workforce, so newly trained dentists or etc. And this particular provider's workforce model was doing exactly that. It was using newly trained dentists, our vocational trainees or something, which is completely inappropriate to deliver urgent courses of treatment. And as much as obviously, he continued to do that, and we said that was inappropriate. You need to change your model, which he did, and then realised using dentists is really quite a costly resource, and actually it wasn't in his it wasn't worthwhile. So he decided to leave the pilot. What we will do, as I said, we do have it in our work programme for 25-26 to continue an urgent access pilot. We've got the funding for it, so we will continue as we are. But over the next 2 to 3 months, we will review the model and see if we can tweak it to incorporate more providers and expand it. And it might mean we need to change the way we fund it, or we might need to change some of the models slightly. But our intention is to try and increase the number of practices that are delivering this service.
Thank you. Yeah, please do.
Thank you. Yeah, the pilot has essentially been a success, but the pilot is exactly that. We are testing a model, and sometimes if a pilot fails, it doesn't fail. It just tells us a certain model is not working. One of the advantages of a pilot within the whole NHS commissioning structure is you can actually set it up quite quickly because it is a pilot and it's time limited. Indeed, I heard at a conference recently, and it's probably true, that the NHS has more pilots than British Airways. But we are going to continually evaluate it, improve it, refine it, try and get the whole model of how it's commissioned better. It's got to work for patients. It's got to work for not just individually, but the population as a whole. It's obviously also got to work for dental practices. If it's not going to pay them sufficiently, they're going to say, not for me, thank you, which in fact is what happened with the one Hitchin case. I don't want to go into great detail about it, but it was the contractor's decision to withdraw, and we did engage as far as we possibly could. And I had direct conversations with him and said, how can we work our way around this? And in the end, he just said, no, thank you, I want to pull out. So we obviously respected that.
Thank you. Councillor Claydon.
I just wanted to pick up on patient outcomes, which you touched on a bit. Do practices get judged on outcomes in terms of health outcomes in addition to how many appointments they get through? Is it, I mean, if they do a good job, is that incentivized? Because in a way you kind of just hinted at practices using very newly qualified dentists, because that way they can presumably perhaps pay less than they might pay those who've been in the profession for longer and still get through just as many patients. Is there anything to?
There is a vast amount of data that we collect, as Michelle mentioned earlier. It's very data rich. We collect a detailed clinical data set for every course of treatment that's provided. We know what practitioners are doing. We can drill down to, forgive that awful pun, sorry, that truly was unintentional. We can go down to individual patient level and practitioner level. And one of the things the NHS BSA does is looks at data coming back from contracts from individual performers, that's dentists or dental therapists, and will flag up where practitioners are varying from local and national benchmarks. And that will often trigger a question. I always say data produces questions, it does not yield answers. But very often when we sit down and talk with a practice, usually the first thing I would do is say, just do an audit on that particular type of treatment that's being provided, or that particular type of treatment that's being provided by dentist X versus the other 3 dentists in your practice. And they'll come back and they'll say, good point. And things change. So yes, there's a lot of monitoring that goes on to try and make sure that we are delivering within benchmarks. There's a lot more that could be done about healthcare, and this is a very, very long conversation if I tip off the edge and slip down the slippery slope and really get talking about it. And really, we do need more indicators. Something that I'm absolutely passionate about is working more about oral health and how it relates to general health. So, for example, gum disease, I can feel I'm falling off that precipice. There's a bidirectional link between gum disease, type 1 and type 2 diabetes, cardiovascular disease. Should dental practices be used as points where we can actually screen patients for hypertension and do pinprick tests to see if they're something called their HbA1c, which is an indication of if they're potentially becoming type 2 diabetic. That's not asking dentists to deal with hypertension or diabetes. That's a medical practitioner's role, but it can lead to signposting either to community pharmacy or into dental practices. And we do have a pilot for hypertension case finding actually running within the county. Can't remember if there's any in North Hearts. I'd have to look, but it is something that is being worked on. There's a national initiative on that rolling forward. As I said, be careful, I'll fall off the precipice. I'll send you all to sleep.
Sounds fine to me. Can I follow up, Chair? Just thinking specifically about checkups. If you're, how does it work in terms of measuring outcomes in terms of checkups? That in that case, it's mostly preventative, right? You're trying to stop people getting to a point where you need to do something more serious. So, can I ask how sort of practice outcomes are measured, or in the case of essentially just routine checkups and things like that, which is presumably a significant chunk of what most practices do.
Well, the question is, what is a routine checkup? And when I grew up, and as you can see, that was a long time ago, everyone was told you had to go to the dentist every 6 months, and that became the mantra. Does not apply anymore. Practitioners are required to risk assess every single patient. There's a guideline issued by NICE. It's Clinical Guideline 019, if anyone wants to look it up, on dental recall intervals. And every patient is individually assessed. And adults, if they're classed as high risk, perhaps they've got active gum disease, a lot of decay, something like that, or perhaps they take certain medication which reduces their salivary flow, which vastly increases their decay risk. They'll be told to have checkups every 3 months. To the other extreme, where people are very stable, they have virtually no disease, or just need to see the dentist every so often to make sure everything's okay, they can spin out to 2 years between checkups. And one of the things we can do is look at recall intervals and see if those on more extended recall intervals are only coming and having a band 1. And a band 1 is essentially, it is diagnosis only. It is a checkup, maybe a couple of x-rays, very occasionally a little bit of periodontal treatment.
Any further questions? No. Okay, well, I'll just finish then by asking, what can we do as a council or as individual councillors to support the work that you're doing or further partnership working here?
Good question.
Well, the whole concept of an integrated care board, which we're still getting used to, dental optometry and pharmacy, or POD as it's called for short, was only delegated in April 23, which was almost yesterday in healthcare terms. The whole purpose of it was to get the health service working more closely with local authorities. We are still finding ways we can do that. Public health departments within, I think that's essentially county councils, we are now working with, looking at how oral health promotion can be delivered. At the moment, it is the bi-directional feedback, I guess, but we need certainly flags. I think it was mentioned earlier about Section 106 funding. I think Councillor Manser mentioned that, and us knowing and being aware of where those are. Historically, as Michelle said, where Section 106 funding is gathered up for healthcare, it's almost invariably put into establishing a new GP practice, expanding an existing GP practice, or perhaps a satellite practice, maybe assisting with getting a pharmacy off the ground to support it, something like that. It's now clear that because the whole of primary care is now within the integrated care boards, where you've got very large developments, that perhaps dentistry should come into that mix as well. Now, again, without going into the significant differences between the way my medical colleagues are funded and dentists are funded, it's quite difficult to actually do it. For example, doctors have their premises fully funded. We don't in dentistry. Dentistry is very much a mixed economy. Every dentist you know is a mix of private and NHS. Most NHS medical practices, with the exception of few services that aren't covered within the contract, are actually NHS. But I'm sure there's a way that some Section 106 funding and similar can be diverted into supporting getting dental practices off the ground, where perhaps you have a whole new town, and certainly areas, as I mentioned earlier, I know Baldock very well. I mean, practiced there for about 35 years. So I know that they are planning to expand in and around Baldock, and that's going to have a significant increase in population. You'll know other areas across North Hertfordshire as well. So yes, that's where I think, I'm speaking very personally, sorry here, but that's where I think working with district council will be very helpful for us to know that, so that at dental we can say we know there's a big development or there's something else happening. But the key answer to everything is communication. I think you've got our generic email address. If there's something coming up, something significant, drop an email in. If they say, we'll come back and talk to you again. Michelle will kill me for saying that.
Thank you. There are a couple more mics come on. So Councillor Wright Mason.
Sorry, it came to me when you talked about collaboration. I know we talked a lot about sort of workforce retention and recruitment. I imagine sort of from our perspective, it would probably be interesting to see an in-depth breakdown, certainly on the retention side, on some of the issues around here. I imagine things like affordable housing, stuff like that is probably a massive factor in terms of workforce retention. So I imagine in terms of existing collaboration, sort of working together on that sort of retaining workforce would be a good thing in my view.
Okay. And Councillor Bryan.
Thank you. Just to say that Councillor Tina Bartras, who's a member of this committee and has given apologies tonight, is the health champion for North Herts, and she is the North Herts representative on the County Council's Health Scrutiny Committee. So she can play an important part in being the focal point for the communications.
Okay, thank you. Okay, are there any further comments, questions? No. Okay, well, in that case, thank you very much for your time this evening and your presentation. It was very, very interesting and with lots of questions, so that's great. Yeah, thank you. Thank you. Have a lovely evening. Okay, yeah, we'll just take a couple of minutes break just whilst we rearrange things here. Okay, welcome back, everybody. We're going to move on now to item 10, which is the Digital Transformation Programme update, and Councillor Ian Albert will present. Thank you.
Cheers, thanks, Chair, thanks, committee, and obviously it's another opportunity for the committee to, as we said in the previous item, to drill down a bit further, but perhaps slightly less painfully, perhaps, than the dentist. Digital Transformation Programme is a very critical initiative for North Herts Council. It's a key delivery tool in our council plan, a council delivery plan. The paper talks about it being a golden thread, indeed. And over the past few years, we've faced numerous challenges, including public sector recruitment and retention issues, multiple business applications with different contract end dates, and a lack of integration between applications. Despite these challenges, I would certainly argue that we've made, and thanks to the team, some really significant progress. In 2023, we embarked on a new chapter of our digital transformation ambitions, with our customer relation management CRM system contract ending in March 24. We had the opportunity to explore various digital platforms. After extensive market research and testing, we selected a low-code solution from Netcall, which offered the flexibility and efficiency we needed. Worth saying here, I mean, and certainly for me, I often sort of struggle with some of the technical aspects of that, and that's why we've got Chris Jeffrey here later to explain more. But low code, if you hadn't come across it before, is a software development method that allows users to create secure applications with minimal coding, and indeed without specialized coding skills. So you can make some really great and quick progress around digital transformation. This solution, as I say, has allowed us to accelerate our digital transformation and develop a comprehensive digital strategy approved by Cabinet in January 24. To date, we've achieved several goals outlined in our digital strategy, including investing in, as I mentioned, that low-code digital platform, implementing live chat and an intelligent chatbot service, moving our intranet to SharePoint, and signing up to the digital declaration. And again, if you haven't come across the digital declaration, it's very much something that a number of public sector organisations, many local authorities, around 300, working with government, MHCLG, and the Government Digital Service have developed a declaration which talks about joined up technology, safe ways to share information, and redesigning services around the needs of people. So an important declaration that we've now signed up to. We've also started several ongoing projects, such as making services digital by default, conducting a customer-centric review of end-to-end processes, and experimenting with new technologies like generative AI. And you'll see from our council delivery plan, there's some really quite an eclectic mix of projects within there that the digital transformation team are taking forward, working on key things like helping to integrate the processes and technologies for the new waste service contract, looking at the town hall booking system, burial systems. So really quite a range of different things and different projects that will help to improve our services, both for the council, but most importantly, improve our services for residents and businesses. As I say, our strategy aims to develop a robust digital infrastructure that supports efficient service delivery and enables swift responses to residents' evolving needs. We're committed to continuous improvement and innovation in our service delivery. We welcome the corporate peer review, which was very positive, but you'll see in paragraph 4.4 in the paper, there are some key future issues there for us to look at around digital inclusion, staff engagement, capitalisation on digital skills across the council. And of course, we also recognise, and I remember that discussion we had some quite late at night, I seem to remember at the council meeting, and that important motion that we debated around, digital strategy, and the importance, obviously, recognising within digital transformation that whilst digital inclusion is really key part of it, but we'll also recognise that there are residents that aren't able to use, for differing reasons, digital services. We cannot ever forget them, and we always need to make sure that our services are available to those, as well as obviously providing these really important and quick online services. So, Chair, with your permission, I'd like to ask our Customer and Digital Services Manager, Chris Jeffrey, to give a short presentation covering off the programme in a little more detail, and then we're obviously open to questions and discussion.
Thank you, Councillor Albert. Yeah, please, Chris, go ahead.
Thank you, Chair. There should be some slides being shared. Thank you. Next slide, please. Okay, so good evening, everyone. My name is Chris Jeffrey, Customer and Digital Services Manager. I'm normally here talking to you about 3Cs, but this evening I'm talking to you about digital transformation, which is the other part of my role. So there will be a little bit of repetition. over what Councillor Albert has just said, but we just want to go into some more detail on the programme itself. So hopefully we'll cover everything off and there'll be some time for questions at the end. So members may be aware that the Council had a transformation programme a number of years ago, which yielded modest results at the time. When the pandemic happened, it brought about significant changes in our work practices and customer interactions, providing an opportunity to embark on a new transformation chapter and accelerate this work for the good of the Council and our customers. So as seen on the slide, and as Councillor Albert mentioned earlier, the Council has been facing several ongoing challenges over the years. Our digital transformation strategy considers these challenges, as well as external factors, such as advancements in artificial intelligence, the uncertainty of local government funding, and the implementation of our local plan, which will increase demand. Recognising that demands will continue to rise, we've focused on making the best use of the resources available to us. To address these challenges, we took the opportunity to build a digital services team from within existing budgets. Alongside this, we had a timely opportunity to explore various digital platforms to replace the customer relationship management system as the contract was due to expire. Through extensive market research and testing, we explored several new platforms to better understand their capabilities and how they align with our organizational goals. At the time when we were doing our research, we saw that an increasing number of councils across the country were utilizing these digital platforms to achieve their goals, while supporting each other through a tight-knit community. We chose a low-code solution in Netcall, which offers the flexibility and efficiency we need, and allowing us to begin significantly accelerating the council's digital transformation. Netcall's platform that we have internally named Connect allows us to rapidly design, create, and deploy applications that can automate tasks, deliver improved experiences, and optimize business operations. In parallel with these efforts, we've developed a comprehensive digital strategy. This strategy is not just about integrating new technologies, it's about fundamentally transforming our operations to better meet the needs of those we serve. It's a commitment to continuous improvement and innovation in our service delivery. Next slide, please. So we chose this as our mission statement. So we want to make life easier for everyone that interacts with the council. Our strategy signifies an exciting opportunity and a clear commitment to continue to deliver on our digital transformation across the whole council. The strategy is acting as our digital compass so that we all understand the direction of travel and what needs to be done, as well as being able to recognise successes as we deliver on those commitments. We know that we need to release capacity within the organisation so that we can focus on making better use of our time and skills by working smarter and by removing inefficiencies where they exist. We see digital transformation as an enabler and a way for us to tackle workforce challenges that are prevalent in the public sector, as well as an opportunity to develop our organisational skills and capabilities so that we can deliver on our ambitions now and continue to build upon them for the future. I'm now going to hand over to my colleague, Polly.
Hello, I'm Polly Simmons, Customer and Digital Project Manager. Could I have the next slide, please? Thank you. So as said, we're aiming to establish a robust digital infrastructure that supports efficient service delivery and enables us to respond to the evolving needs of our residents. With the aim of future-proofing the council, these are our goals and objectives. Efficient working by removing manual and duplicate processes, enhancing employee experience and making better use of our resources, gaining customer insight and also bringing this together from different areas to provide a consistent and enhanced service, and in turn providing us with better data. Reduction in current and future costs by decommissioning several legacy applications and replacing them with solutions built in-house, releasing cashable and non-cashable savings over the long term. Faster development and accelerated innovation with an iterative approach. More agility and faster response to feedback and changes, and collaboration with other councils working together to achieve efficiency and consistency for common customer touchpoints. As Chris has touched on, it's important that digital transformation in the council is cultural as well as product-based, and we've built our framework around this. Next slide, please. So this framework actually isn't in the strategy, but we felt it was important to highlight some of our areas of focus. First of all, being people. So we believe that the success of our digital transformation depends on active participation from our people. We're really lucky to have top-down support and engagement, but are also ensuring that our teams are involved in the process from start to finish, so that our initiatives reflect the diverse needs and expectations of our staff and the communities they serve. Our build projects are very collaborative with the service areas, and we're also providing skills updates and training to ensure there's a level of consistency across the council and a culture of learning and inclusion in digital change too. Digital transformation isn't a project that's ever really finished, and it's not something that's done by one team in isolation, which is why we're committed to a culture of continuous improvement that brings everyone into it. On the process side of things, our approach is agile and iterative. So we prioritize flexibility and adaptability, allowing us to test, learn, and refine our strategies as we go. And this ensures that we can continuously improve and innovate in our digital offerings and adapt to changing customer expectations. By regularly monitoring and evaluating our digital initiatives, we can measure their impact, identify areas for enhancement or optimization, and ensure that we're continuing to deliver value to our residents and staff, keeping their experience at the core of our work. I'll hand back to Chris.
Thanks, Polly. Next slide, please. So what success looks like. So this slide outlines what success looks like for the council. This comes from our digital strategy, which I'll talk about more in a moment. I won't go through all of them. You can see them on screen there, but the metrics that define the success of the program effectively boil down to costs and efficiency. So can we make things work better and more easily? And can we reduce costs through external suppliers and subscriptions and enable council budgets to go further? In terms of success so far, Councillor Albert did mention a few of the things we've already done. There's plenty of work done so far that is outlined in the strategy that we have ticks against already, including signing up to the digital declaration, investing in a digital platform, and building a suite of new digital services. So under that banner, some of the applications that we've already delivered include the customer relationship management system, and all the online forms were replaced and enhanced. The My Councillor account, which some of you may be using, we built that on the new digital platform. We've delivered a bookings application for Hitchin Town Hall. We've also delivered an out of hours application for Careline. We're working on an FOI application for our information team that will aim to reduce the number of systems they use from 3 down to the 1. We've also started work on an application for our burials team, and also the team that use the grants database. There's some work going on there as well. And a project you'll all be aware of is the garden waste project. So we're building a portal for the garden waste subscriptions, and we're also going to be working on all the associated online forms in the coming months. When we look at success in an economic sense, we don't have a specific target. We know that cashable savings will come in the longer term as we align with contract end dates. Success to us also means non-cashable savings, where we're improving processes, avoiding money being spent on procurement, and a better customer experience. Next slide, please. So the digital strategy, which was uploaded as an appendix, so hopefully you've all had a read. It was put together at the beginning of 2024, and it outlines our vision and aims of the programme and shows the number of external factors that have had or will have a significant impact on the council. As transformation is not new at North Herts, the strategy also details what we have done so far since 2014. Since its inception, we have spent a lot of time trying to demystify digital transformation with colleagues across the council. hopefully ensuring that everyone knows we are working with them and not doing things to them. So we want to bring everyone along on the journey with us. So as a part of that, we've tried to avoid using jargon where we can. There are still a few buzzwords floating around. Councillor Albert did explain what low code means earlier, so that was very useful. But we've also mentioned an iterative approach, and that is the practice of building, refining, and improving a digital application. So we are trying to avoid the jargon where we can, but in things like the strategy, sometimes it's unavoidable. As noted at full council last month, the midterm review of the digital strategy will include how we can signpost to the organisations already doing some really great work across the county when it comes to digital inclusion. Next slide, please. So this slide shows our vision and guiding principles as outlined in the strategy. We use this framework when considering any new projects for the programme, and I've just picked out a few to talk about. So in terms of digital first, we want to put customers at the heart of our services, making services digital by default so that they can be accessed 24/7 and so that customers can get what they want from us without needing multiple interactions or contacts. We want to provide a seamless experience across all channels and will ensure that we do not leave anyone behind by still providing the traditional contact methods for those who need them. Making technology work better for our staff. We know that our staff's time is precious. Workloads are high, and so we want to remove pain points for them so that they can focus their time and efforts on higher value tasks and delivering for our customers. We're aiming to rationalize the number of applications we use and seek to remove any frustrations within the technology that we use. And Polly mentioned earlier about organizational culture and capacity. So we will put digital technology at the heart of how we work, recruit and train our staff to build on a culture of digital, both now and for the future workforce. We have created a group of digital champions across the organisation and aim to support everyone with the digital changes as we go. As I said, trying to keep everyone on board and working with them. We want to invest in ongoing development of digital skills in our staff and councillors, who in turn can support our customers and residents where needed. Next slide, please. So this slide is showing the wider council support that we got when we were putting together the strategy and the engagement that we had from everyone. So as part of the development process, we consulted widely with a range of stakeholders. The strategy was developed in consultation with the executive member and deputy executive member for finance and IT, the shadow executive member for finance and IT. We brought in an external consultant from ILGA, which stands for the East of England Local Government Association. And we conducted a digital maturity assessment that was looking at how ready we are as an organisation for change. We also had a review from SIAS, reviewing the strategy. They were providing a critical friend approach, and they also helped to benchmark our strategy against other council strategies. And in 2023, we held a couple of sessions with our senior management group, and those sessions showed us that colleagues from across the council all shared the same challenges and desires, wanting things like better integration, systems linking together, eliminating human error, and sharing data between services. And I will hand back to Polly.
Thanks. Next slide, please. So as you can see, there's been lots of great work since we started on our transformation journey. Last year in November, the corporate peer review was held, where one of the focuses was around capacity to deliver. The feedback was really positive, which we were obviously pleased with. And the peer said that what we've done to date was impressive, and although it was early days, they said it was clearly working well. To underpin our focus on learning and development, we also began our partnership with Multiverse, who are an Ofsted excellent training provider, to offer digitally focused apprenticeships to staff across the council. So 19 staff members joined the first cohort, and are working on apprenticeships such as AI for business value, business transformation fellowships, and data and insights. There'll be more opportunities offered later this year, and as the first cohort progresses, we'll begin to capitalize on the skills being learnt, allowing us to continue to add value to the business. On the topic of AI, I know it's been mentioned, but we are currently trialing Microsoft Copilot with a small group of users, led by our management graduate, Maddie, who's done an incredible job to date, with plenty of support from the management team, of course. The rapid development and adoption of AI has opened up new possibilities for innovation and efficiency, significantly impacting the public sector. Our Copilot project is currently focused on how North Herts can best leverage this technology. And we've taken a phased approach, with the objective of the first phase being to determine the potential uses and governance requirements, with a controlled group of 20 users from across the organisation who are feeding back regularly. We expect that Copilot will provide several benefits, including enhanced staff well-being, productivity gains, improved service delivery, and increased staff confidence with technology too. As you can see, there's lots more work going on by the digital and IT teams, and this is outlined in the digital strategy provided as an appendix. In summary, though, our digital transformation journey is about creating a future-proof local authority that's responsive, agile, and importantly, resident-centric.
Thank you, Polly. There is one more slide, I believe. Yeah, future work. So yeah, we are very excited about the possibilities that digital innovation brings, and we're very dedicated to making this vision a reality for our community and our staff here at North Herts Council. That's the end of our presentation, and we will hopefully answer any questions that you might have.
Thank you, Chris and Polly, and we've also got Joe Duffsey on the line as well, if needed. So lots of questions. Good, Councillor Prescott.
Thank you, Mr. Chairman. Okay, so describe me as naive if you wish, but it strikes me that there are going to be councils up and down the country that are on this journey, perhaps at different stages along the way. Is there not an argument that says there should be some central project that is doing all of this work, and when we just all adopt what is done, rather than having loads and loads of people and consultants and strategy groups and all the rest of it in all of the different councils, districts and counties or whatever, all spending vast slugs of taxpayer money to all effectively achieve the same thing? Or am I just being naive?
Councillor Albert, take that, maybe.
I mean, I'm happy to start with that. I think in an ideal world, we'd obviously want to be able to, I think, cooperate and I think work across the board. And clearly, obviously, local government reorganisation will give some opportunities to do that. And indeed, because I think actually North Herts in both digital and IT are ahead of the game. I think part of the issue, I think, is over the piece. We've got a government digital service that was created some years ago, but clearly it doesn't do is to effectively command or dictate what happens. It guides, but it is left to organisations, whether it's North Herts, Herts County Council, or other metropolitan authorities, to actually take these things forward. But there is no question, you're absolutely right, there is clear synergies, and obviously makes sense to be able how you can sensibly cooperate. And I think one of the things that we've learned, when we even sort of here where we've seen more shared services and how councils can cooperate and operate together, I think is a welcome development itself. So that I think is, if we weren't doing local government reorganisation, I think we would need more shared services whether it's IT, digital, legal, and so on, because actually that it doesn't make as much sense where you've got specialisms of this kind not to be able to cooperate more broadly. So we are where we are. I don't disagree with you, but I think we've got opportunities to see how we can bring things together in some different ways. I mean, in the future. I mean, I don't know whether Joe, might like to comment from.
I'm told that Joe has a hand up, so yeah, we'll allow her come in. Thanks.
Thank you. Yeah, I think just a couple of points to add is that obviously each council has their own setup that has been in place for many years, and in many ways will be unique to them. So there is a big piece of unpicking potentially there in the future. But the other thing to mention is that with the platform that we have implemented, the NetCall solution, one of the advantages and the benefits of that we were very keen on is that it has a very large community of users that collaborate and share and meet regularly to kind of talk about areas of focus and how we can work together and share information. So there is a lot of collaboration that's going on, albeit we're not necessarily yet building things together, although that is something that we have started to have conversations about, particularly in terms of some of the more challenging systems that we will get to in due course. So yeah, just a couple of points to add there that I think are relevant.
Thank you. Briefly, yeah.
It really does. It strikes me that we're constantly trying to reinvent the wheel here, and to hear an officer say that we are significantly different here, or whatever your words were, I don't really buy it, because we can't be that different. I just want to leave that one sitting there. I don't really want to start an argument with anybody, but as a taxpayer, I want to see efficiency.
Yeah, Councillor Bryan, do you want to comment?
The customer care part of my portfolio, we're ahead of the game, and Chris is reacting to needs within this organisation, to our exact needs. And I may be misquoting, but I think he's replaced, it's over 100 applications so far. So we are working apace. And I get what you're saying about collaboration, but at the moment, this is the best way forward for us.
Okay, let's move on. Councillor Wright.
Thank you, Chair. So I'm sort of interested in your being data-led in our decision-making objective, which I welcome. I'm just wondering, how do you plan to go about implementing this objective? For example, how will you ensure that you're collecting the right kind of data and joining up data sets across the services? What data analytics you might plan to develop? And will you be establishing any KPIs to measure the success of digital initiatives?
Shall I start this one off, and then yeah. Chris or Polly may want to jump in. So in terms of data, that's one of the challenges that we have at the moment. And one of the challenges that was definitely highlighted whilst we were looking at the strategy and the approach that we should be taking, because we do have different data sets held in different systems, not speaking to one another. And so this was one of our challenges and aims, to try and bring those systems together and therefore the data sets together. So we are quite early on in terms of the data side of things, and Chris mentioned, or Polly mentioned earlier, that we've got a graduate that's working on our AI pilot, and we're also doing some work around starting to develop a data strategy. Additionally, to support that, Polly mentioned the multiverse partnership that we have, which is in part upskilling members of staff around data and kind of data insights for good business decisions effectively. So I would say that we're early on in that part of the journey, but I don't know whether Chris or Polly have anything that they would like to add to that.
Just to add that, yeah, we'll be tasking our graduate Maddie with a benchmarking process to look at what data strategies other councils have in place. So that gives us a bit of a start for that project in itself. But as Joe said, we are in the early stages of looking at that strategy.
Okay, thank you. Councillor Winchester.
Thank you, Chair. Well, I'm very impressed by the progress that's been made so far. I'm particularly, I would just like a little clarification on the timeline around the launch of Connect. And have you actually really built a whole new CRM from scratch? Because obviously that's the absolute backbone of service delivery. And I can imagine if that doesn't work, that could be really problematic.
Yes, that has been
Yeah.
built from scratch. That was the first application that we launched. Yes, and it was actually developed in a relatively short time period because of the contract end date. So obviously going through procurement processes and service design and everything like that. But that was one of the benefits of having this type of system, the low code, which meant that the team were able to work at pace, albeit it was new at that time. And so, as time goes on, they are obviously enhancing their skills and knowledge in terms of what they're building on the system. But yes, that was the first application that the team built from scratch.
Thank you.
Okay, Councillor Manser.
Thank you, Chair. I have got a couple of questions on this, but the first one relates to how this is being integrated into the organisation and what has been the response from staff? Has it been quite a positive response? Has it been a collaborative response? Are staff, picking up the baton of digital transformation and applying it to everything that they do?
Yeah, I'll start that one off again, and Chris and Polly can feel free to jump in. In terms of integrating, so it is one of our corporate projects. It's now on the council delivery plan. And so obviously we are reporting regularly on it. We are also regularly discussing this at every opportunity that we can with the whole organisation. So things like staff briefing, senior management group. Chris has already mentioned about the peer review that had a look at it, and we asked SIAS to have a look at what we're doing as well. So it is being integrated. We're very fortunate that we've got very good support from Anthony and from our exec members. We do have an oversight group that meets regularly to kind of review progress and give some strategic support and direction to the group. And in terms of staff engagement, I think there's more we can do there. I think, it's a continual piece of work for us to keep people engaged with this. But I mentioned, the forums that we kind of speak at, or Chris and the team attend and communicate with. We have regular updates on our insight and on the intranet, the hub. So yeah, I think we've got good levels of engagement. Chris and the team are being approached by colleagues who want to work with them to build applications, to replace systems, or to develop something new. So yes, good level of engagement, but we're not complacent about that. I think there's more we can do, and we will continue to do everything that we can to bring people along with us.
Thank you. I'm just going to go to Councillor Albert because he's.
Yeah, I mean, I think we know that change is challenging, and clearly in any organisation, but I think with the right. But all the things that we've seen in the sort of staff surveys, all the things we've seen in the sort of sessions with staff, is what you see is people say, oh, actually, do you know, in my area that I've got an idea about something. So, for example, the FOI database. Now, anyone who's tried to look at our FOI at the moment and try to see and work your way through it, and you then know how difficult it is for staff to try and compile responses, make sure that they're consistent and so on. And actually, what staff can then see is if we can actually develop a different and very flexible, agile database, actually it saves them a huge amount of time in providing responses and so on, providing statistics, looking at actually the quality of those responses, and they can see a real benefit to them in their day-to-day jobs. And I think that's the joy and the delight of this program. I think that people, I think, that do find it, change is hard, but then they can actually then see the benefit, because it makes it really much quicker and easier and better for them to do their job. And then equally, then whether it's the council or the residents, you can see the information that comes out the other end in a much more transparent way. So there's win-wins all round here. But yeah, you need to keep that message going with staff. That's critical. Staff are our most valuable resource, and so we need to work closely with them at all times.
Thank you. Yeah, I'll come back to you, and I'm just going to follow up on that point actually. So to what extent are the sort of users of these systems, most of these being internal tools, are they involved in the development process? Obviously, part of the agile process is kind of tight feedback loops with user feedback. Are you involving the people who are using the systems in developing the systems?
Yes, absolutely. And I'll perhaps invite Polly to speak on this, because Polly is project managing, and so she has a lot of kind of close
meetings with people,
with colleagues. So I'll hand over to you, Polly.
Yeah, no problem. Yeah, the service areas are really involved in the planning and the build processes. We work really closely with them and get their input on exactly what they're looking for in their new systems, the problems they have with current systems, how we can make their lives easier and improve those processes, and then continue to consult them along the way and show them as we're building so they can feed in, which makes our lives easier as well, because we don't go too far down the line before we realize something is wrong, but also because they're so involved with it, they're really invested in the outcomes by the end, and they really feel like it's theirs and it's custom to them. And we've built really good relationships, as Joe said, with the services that we've worked with. We've had them coming back for new projects with new ideas of other things that we can work on. So it's been really positive.
That's great. Thank you. Councillor Manser.
Thank you. Could I just touch upon a point that you, Councillor Albert, raised with respect to benefits? Benefits, obviously, to the organisation and obviously to the members of the public as well. And breaking this down into two parts. The first part is the savings of which have been made both as of this moment and the projected savings, as well as the productivity rate. Have we seen an increase in that productivity rate in our staff? And if so, what is that?
So I think the two things to say there. I mean, firstly, this program is about enabling rather than itself, and I think it was Chris who mentioned earlier on that obviously there isn't a formal sort of savings sort of target, but you're right. I mean, I think we do need to be able to, and certainly happy to take away about what we can track in terms of processes. For example, I touched on the FOI. That if when that application becomes live, and you can then see how we're dealing with FOIs and what actually it's delivering in terms of efficiencies and savings within that, and you can look at all of those things. Some of the areas, of course, where you look at town hall booking systems for another part of the council, clearly aren't about necessarily itself making savings. It's hopefully about driving more people to come and book the town hall, and that isn't then always simply and easy to measure as to what the benefit of that is, other than you can purely see maybe there's more bookings, but you don't necessarily know that it's the booking system, and it's easier to do online than it would ever was in the past that's done it. But I'm certainly happy to take away what we might be able to look at tracking in relation to the program, in recognizing it is an enabler. But I don't know, Joe, if you wanted to sort of add anything from your perspective, or Chris, in just recognizing that the savings on these things and the efficiencies sit elsewhere.
Yes, yes, certainly. So, longer term, there will be savings that we will be able to measure as we get to contract end dates and things like that. But we're not quite there yet because we're early on in the program, and obviously some of the systems that we have in place at the moment, we're tied into contracts, so that dictates some of the work that we have to do and the timings of that. The other thing to mention is that an aspect of this is around cost avoidance. So one of the applications that Chris mentioned that is on the programme is the burials database. Now, by us building that in-house, that avoids us spending in the region of £50,000. So, you know, there will be a number of things like that, and as well as we replace systems that have perhaps been built in-house but become end of life. Again, there's a cost avoidance aspect there as well. And then in terms of the productivity, yes, as time goes on, we will be able to track that more. But in some cases, this will be about leveling the playing field a little bit, because we know that, you know, areas and teams across the council don't necessarily, or have in some cases more work than they have resources. There are capacity issues. And so by making things easier for them, then that helps with that, you know, kind of issue as well. So I guess that was a long-winded answer. Yes, there will be savings that we can identify as the programme develops. There will be more opportunities to track some of the productivity things as well as time goes on. So yeah, hopefully that answered the question.
Councillor Claydon.
Thank you. Given recent experience, I wondered if you could say something about what's being done to ensure the new systems are resilient to future cyber attacks, and what expertise the council is able to draw on in that area.
Can I just sort of start, and then I'll bring in Joe. One of the key things that we set out and it met this afternoon was a cyber board, which obviously Councillor Ward and myself sit on. It's sort of cross-party board, but obviously with key officers, senior managers, the IT manager. So actually making sure that our systems are robust, secure is absolutely a critical part of that. I think the figures he sort of set for, I think Darren set for the last quarter, or something like, you know, over sort of 20,000 cyber attacks, all of which were prevented and blocked in one way. So this is, you know, an ongoing day by day issue for this council. We're not by no means the most targeted. Many others are targeted way more than we are. But you can never and ever stop that kind of sort of vigilance. So having secure systems, and I mentioned about Loco being able to develop and create not just apps quickly, but secure apps, and that's obviously part an application is really key part of it. But I don't know whether either sort of Joe or Chris want to cover any more sort of slightly more technical aspects than I've covered there.
I think the thing I would add to that is that the IT manager who is also our cybersecurity lead corporately, is part of this project and programme, and in relation to all applications or all, you know, technology that is introduced into the organisation, there is a robust process in terms of looking at the security of those applications, both in terms of through the procurement process, through the IT assessment, and the ongoing work that the IT team do in terms of protecting, you know, the whole organisation. And as Councillor Albert said, we did meet today. We do have a corporate cyber board, and that has, as well as member representation, that has representation from the shared internal audit service. and senior officers in the organisation, including Anthony. So yes, I think, you know, as robust as we can be in terms of what we can ensure there.
Thank you. Councillor Williams.
I think the strategy looks great, right? And the opportunity for workforce efficiency is, there. It's really impressive uptake with digital upskilling and the amount of apprentices you've got. And I think that's testament to your internal change management. I think it's really good. So following on from Ralph's questions, really, I want to think about the community experience and the opportunity to enhance the customer experience. The idea is that it's better and easier to access council services. Ultimately, that is going to impact productivity, but there's also that ease of use to help people encourage to switch over. So we've talked a bit about success is entirely dependent on bringing people along. So what is being done in that respect in the community to bring people along, to encourage them to switch online, to make them aware of what can be done online, so that we can help to shift the balance from the traditional ways of contacting the council?
Chris, do you want to take that one from the customer service side?
Yeah, no problem. So we recognise that the digital strategy is focused fairly internally, but as part of the midterm review of the strategy, we will be looking slightly wider. We, of course, want to include our residents and our customers in what we're doing. We do have a communications plan in place, and as part of that, we will be going out to our residents. We don't know the finer details of what that looks like at the moment, but we certainly want to include residents and bring them along on the journey with us as well.
Councillor Albert.
Yeah, I mean, I think it's certainly an area that we can look at and do more on. And I think we obviously be, here would be really be gratefully advised by, Scrutiny colleagues here as to what if you've got ideas of things that we should be doing more. Certainly we've got what I think the corporate peer review showed, that actually the North Herts Council is really good at working with a range of partners, social partners, and so on. And I think we need to build on that, and working with those partners about the things that we're doing, and making sure that they're aware of that. And then, of course, then never forgetting that that whatever we do sort of digitally, as we said earlier, that we need to make sure that all our services are available to all the people in all the different forms and ways. And it's great doing these things that we're talking about here, but making sure we've got things out in the libraries and all those other things of that kind. But I certainly welcomes suggestions from colleagues about things more that we can do. But as Chris and I think Joe said sort of previously, I think that in wider engagement through the digital strategy, the review that we can look at, that we talked about at the last council meeting, I think that will help to sort of build on that wider engagement work that we can do more about. But really happy to take on board any suggestions and comments from Scrutiny colleagues.
Thank you. Councillor Peace.
I think I'm following up on that probably then. Talking about the corporate peer challenge, which said that we should focus on digital inclusion. In my ward, we actually run a weekly digital inclusion group that's there for people to fill in forms. And it's incredibly eye-opening, actually, how difficult some people find digital engagement. And how to reach these people is a problem we found. You can't reach these people by a website or Facebook because by definition they're excluded. So I think my question was, when these systems go public facing, it's really easy to identify the number of people you've got engaging with you, but how do you identify the number of people that are excluded from using these services?
It's a difficult one to answer. We know that obviously, as you say, the residents that do access our services, we have a number of residents that come in to see us at the district council offices in reception. We aim to help those customers that need it. We have the self-serve computers there that the team will assist with and show customers how to do things on the website. We've also had a partnership in the past with a company called We Are Digital, where we offer digital appointments for those that need it. So again, they can come into reception and we can help them fill in gov.uk forms. So yeah, the support is there from my team, the customer service team, either over the phone or in person. But as you say, finding the ones that are actually excluded is difficult and a part of the challenge. So I'm open to any suggestions that you might have.
Thanks, Chris. And Councillor Bryant, do you want to comment on that as well?
Thank you, Councillor Peace. Following on from the motion that was brought to Council last week, this is a big piece of work we've got to do and we were working on. And one of the questions that came up at Council, and certainly was discussed, was whether, in fact, we should be reporting back to ONS on how we are progressing with that. So I'd be willing to hear your answers on that.
Yeah, I think we can take that as part of the work programme discussion. So thank you, Councillor Bryant. Councillor Munster.
Thank you, Chair. And I know, obviously, we're not discussing the council delivery plan, but I note Councillor Albert identified 4 of the success stories, shall we say, and actually there are 22 goals within this strategy. So would you be able to provide any indication as to sort of how many of these goals have we actually achieved? And I just note that it is quite a strategy that is quite front loaded in that, you know, next year, and granted there are still 3 months of this civic year, but we have for 25-26 consider a fully integrated telegraphy solution for a complete on-channel experience. So how do we move forward with this? And when are we going to see a strategy that, you know, covers the next couple of years being brought forward?
Someone online want to take that? Or
Yeah, I'm happy to take that. Just to say that we do have a review of that strategy. It was developed to cover 24-20 to 27, recognising it was the first strategy, and therefore we were likely to need to make amendments to it. And that technology changes at such a pace that we don't want to, you know, develop a strategy that is going to become outdated as soon as it's developed. So we are doing a mid-term review of that strategy later on this. So pick up on the digital inclusion work that Councillor Bryant has mentioned as well.
thank you. I think some of the items are on the roadmap that Chris presented to, weren't they?
Yep.
Councillor Albert next.
Yeah, I think that was exactly the point. That making sure, I think that how that roadmap works with the council delivery plan and so on, because there's a range of sort of tasks there. I think the other thing is obviously looking as sort of Joe and Chris mentioned earlier on, looking at where we've got things coming to the end of contracts and what we might need to be able to do, or where we can build into our work program that work that helps us to avoid future costs. But yeah, we're certainly happy to take those points away, Ralph, to, you know, make sure those fully picked up in the plan.
I suppose a question in simpler terms is, with respect to the identified achievements for 23-24, have we actually achieved all of that? Are we on course to achieve everything of which we aspire to for this civic year? And of course, you know, in the future, are we on track to ensure that we are going to achieve all of those targets?
Are you talking about page 28, 9, 30?
Yes, yeah, page 29 and
yeah.
page 30 in the report. Because I mean, we either have achieved these aspirations or we haven't.
I think it's important to note that a lot of these are actually ongoing aims and ambitions. We do track the progress against the strategy. A number of these are done. So investing in a low-code digital platform, implementing chatbot and live chat services, moving our intranet to the SharePoint system, and signing up to the digital declaration. But a number of those other points are ongoing. They have started and they are ongoing. But I take the point that the aims perhaps need to have an end goal in mind, but the things that we've chosen, they're very, very important to the council. And as I say, they are ongoing pieces of work.
Okay, thank you. Councillor Claydon.
You mentioned the pilot of Copilot. Just wondering whether you could give a sort of reasonably concrete example of where you see that might be used. I recognize that it's fast-moving technology and that it's a kind of an experimentation thing, but you mentioned well-being, for example, as one of staff as one area. Just wondering whether you can sort of make a little more concrete what something might look like that would leverage that technology.
Polly, I might come to you in a moment, if that's all right. There are lots of use cases across the council. We've identified a number of users from various service areas. It can be used in a variety of different ways. And as you say, we are experimenting with that technology and how it can benefit us. It might be generating a job profile in HR, for example, or creating emails from scratch that you might need help with, or flagging the most important emails in your inbox. There's so many use cases, and we're just kind of trying to scratch the surface with that. We know that there's a lot of efficiencies to be had from it transcribing meetings that we have. So there's a number of meetings that we have across the council every single day. Unfortunately, we haven't got to the point of being able to use that functionality yet, but we know that there is efficiency savings to be made there. So it's an ongoing journey trying to figure out the best use cases and what the best prompts are to kind of get us going. But yeah, it's certainly one that we're finding very interesting, and as I say, trying to scratch the surface with. But Polly, I don't know if you've got anything to add to that.
Yeah, so from a productivity standpoint, there's, as you say, lots of ways that it can make things more efficient and quicker and make things easier to find and kind of cut down on that admin time. But from a well-being standpoint, apart from stress reduction, there's also cases of it being used as a reasonable adjustment tool as well. It can help people with writing emails or finding information, summarizing long documents. Yeah, there's lots of cases for kind of support with reasonable adjustment too.
Thank you. Just to follow up on that, the productivity benefits of Copilot are fairly sort of well publicized, I think. What training are you giving to people around the sort of data protection risks and other risks associated with these types of tools? And also separately on the use of AI, is there anything kind of customer facing in the pipeline that you've got in mind?
So I can answer the first part of the kind of data protection standpoint. So the way that Copilot is set up, it fits into our Microsoft tenant and adheres to all of the governance that all of our other Microsoft tools use. So IT have set it up so that it only references our own servers and our own documents. Anything that's uploaded to Copilot, any prompt that it's given, it doesn't use that information for training its AI models, which is what, ChatGPT does and where the concerns come in there. So it stays within a closed environment.
Thank you. Just want to pick up the second question around any sort of customer facing improvements or
Yeah, so in terms of customer facing at the moment, the chatbot that we've implemented is a navigational chatbot. It doesn't have any AI behind it, but the next iteration of that I'm exploring now is an AI chatbot. So it will use the AI technology to provide the answer to the customer, and that will have live chat linked to it as well. But the other side to that is on the telephony channel. where it will use AI to provide the answer to the resident. So I'm looking at it providing the kind of low-hanging fruit answers to customers, are kind of FAQs, that kind of thing. So then that provides more time to my staff in the customer service centre to answer the more complex inquiries. So there are things in the pipeline where we're looking to use AI, but as we've mentioned, we're looking to get all our policies and our acceptable use case policies in place prior to that.
Great, thank you. Councillor Wright.
Oh, sorry, I haven't gone red yet. I've got a question that kind of relates to the digital inclusion issue, and it's around kind of accessibility of content. So I'm just wondering how you will go about sort of ensuring that all the digital content and services kind of meet diverse language and literacy needs. You know, do you have a set of guidelines around that?
Yeah, so all of the builds that we're creating adhere to accessibility standards. There are kind of guidelines that we can use to check against that. So we do make sure that they are accessible to people.
One more question from me. In terms of cloud infrastructure, it's mentioned in the document, but fairly briefly. How much does that play a part in the strategy? And in terms of the skills that we've got to support, it's obviously a bit different to on-premise hardware that we've got at the moment. Do we have a plan in place to kind of upskill in that area in particular? Maybe that's one for Joe.
Yeah, shall I take that one? So that falls more into the IT roadmap side of things, and at the moment cloud is being looked at on a kind of a case-by-case basis, and obviously cost is a big factor as well in terms of, you know, whether that is appropriate, costs, you know, security and everything like that. But I think in terms of staff, they are more familiar with using you know, cloud-based systems. We have a bit of a mix in terms of cloud and non at the moment, but we haven't gone as far as to say we are going to make, you know, move everything into the cloud. We kind of need to reach a point at which financially it does make sense, and that we move enough that we don't need to replace kind of on-prem hardware and things like that. So at the moment, that's, as I say, it's kind of being looked at on a case-by-case basis. But certainly within the IT team, the skills are absolutely available.
Thank you. Okay, are there any further questions? No. Okay. In that case, is there anything to vote on here? Not got anything in the report. No, it's just a note. Okay, great. In that case, I'd like to thank Councillor Albert and the officers, Joe, Chris and Polly on the line for your contributions. Thanks everyone for your questions. And we'll move on to the next item. Thank you very much.
Thank you.
Thanks.
Thank you.
Have a nice evening. Okay, so move on then to item 11 and item 12, which is the Overview and Scrutiny Work Programme 2024-25 and the Decisions and Monitoring Tracker. Jeevan Mann to present the updates.
The work programme has been compiled following conversations with the Chair and the Vice Chair and includes the annual reports, items from the full plan and possible items for scrutiny in Appendix A. Any suggested topics for the work programme or task and finish group will be greatly appreciated and can be raised in this meeting to the Chair or Vice Chair or by emailing the Scrutiny Officer mailbox, and I'll begin to investigate them. We're looking at arranging for the Centre of Governance and Scrutiny to host sessions on work programming as part of the Member Development Week in May 2025. This will focus on the importance of long-term planning as well as how to identify and prioritise topics for inclusion. This session will be supported by a session for ONS members at which we will consider what items you may want to add to the 2025-26 work programme. Section 106 Task and Finish Group. Section 106 training took place on Monday 13th of January 2025. A background paper was circulated to councillors relating to the effectiveness of Section 106 obligations in delivering community infrastructure. An email has been sent to group leaders today regarding proportionality of the group. Following confirmation of this, I will contact group leaders next week requesting nominations for the task and finish group, as well as suggestions for chair for the group. Please let your group leaders know if you want to be part of this group. LGA peer review. The LGA peer review actions are now included as Appendix 6C to the report so that members can review the progress of the actions. There was a proposal put to councillors with regards to the council delivery plan to align it to update against service delivery updates. This will enable members to have a detailed look at each service area projects, and the corresponding executive and officers will be on hand to answer any questions. It's therefore hope that this will ensure that detailed questions on specific topics within a portfolio can be answered within the meeting rather than a follow-up response. If members could provide their questions in advance of the meeting, this would be appreciated, as it allows for a response to be researched and compiled by officers to provide at the meeting. The quarterly council delivery plan may still be circulated to members for information. The council delivery plan will next be generated in line with the planning and transport portfolio update for ONS meeting on 11th of March 2025. Do we need to notify? Okay, fine. Next section is decisions and monitoring tracker. The referral and recommendations in the decision and monitoring tracker were made to Cabinet on the 14th of January 2025, following the ONS meeting on 7th of January 2025. Councillor Mick Debenham, as Executive of the Environment and Leisure, presented the referral from Overview and Scrutiny Committee on the Leisure and Activity Communities Agency Model. Councillor Ian Albert, as Executive of Member for Finance and IT, presented the referral from Overview and Scrutiny Committee on the Council Delivery Plan 24-25 Quarter 2 update. And Councillor Amy Allen, as the Executive Member for Recycling and Waste Management, presented the referral from Overview and Scrutiny Committee for the Garden Waste Charges. All these items were considered and recommendations noted by Cabinet. These will now be marked as complete. Thank you, Chair.
Thank you, Jeevan. Are there any questions or comments on the work programme at all? Councillor Claydon. Thank you.
I just wanted to suggest that in addition to digital exclusion, which we've discussed as something that we could maybe look at, that we could maybe consider also looking at the data strategy, which I think was mentioned in the previous item in response to a question from Claire. That was remarked as being relatively early in development, and it seems pretty important the way that the council handles all of its data. It seems that it's an area where there's lots of, at the moment, there's potentially lots of data and lots of silos, and it was mentioned that it doesn't really talk, there's not good communication. Just wanted to suggest as a possibility that we look into that, because developing a data strategy is part of the roadmap for that item.
Okay, I think we can definitely consider that on the under the future topics. Are there any other questions or comments at all? No. So I just wanted to comment on the March meeting, which is the next one, the final one of this year. We have the peer challenge reports, which was done in the peer challenge from November, the report and the actions coming back there. We have a planning and transport portfolio update. And as Stephen's outlined, the intention is that we sort of roll the council delivery plan into that. So the focus will be on the projects within that portfolio. And we won't then consider the wider report at the meeting. That's kind of what we're trying out as the new procedure. So we'll drop that from the agenda, but it will still go out probably in MIS or in some other form. Yeah, museum storage, we're expecting an update on that, and the RIPA annual report we have to do from a compliance point of view. So that'll be sort of, as I see it at the moment, that's the basis of the meeting next time. The draft annual report of the ONS committee we've agreed to push into next year and just do it once rather than have a draft report and then a final report. We'll just do it once in June. So yeah, and obviously, hopefully we'll have a task and finish group that can start to feed us back some early feedback by that point as well, which would be great. Okay, I'm not seeing anybody else asking to speak. So in that case, we shall move to the recommendations And as I mentioned at the start, we'll have to do item 11 first and then item 12 after. So let's go for that. So recommendations for item 11, that the committee prioritises topics for inclusion in the work programme attached at Appendix A and where appropriate determines the high-level form and timing of the scrutiny meeting of the committee. 2.2, that the committee, having considered the most recent iteration of the forward plan as attached at Appendix B, suggests a list of items to be considered at its meetings in the coming civic year. 2.3, that the Corporate Peer Challenge Action Plan as attached at Appendix C be considered. I will propose that. Could I have a seconder, please? Yeah, Councillor Tyson. Any debate? No. Okay, let's vote on that then, please.
That is carried, Chair.
Thank you very much. And we'll go to item 12, the recommendation that the content of the decisions and monitoring tracker be noted. And again, I'll propose and go to seconder. Yeah, Councillor Tyson. Any debates? No. All right. And we'll vote then, please, Robbie.
That's also carried, Chair.
Thank you very much. In that case, we'll close the meeting. The next overview and scrutiny meeting is scheduled on Tuesday, the 11th of March, 2025. Thank you very much, everybody. Have a great evening. Bye.